There has been a rash of new HIV cases in Indiana, 26 people infected in southern Indiana.
Now, the state health department has a team of experts right now working to try and contain that outbreak. Eyewitness News reporter Jeremy Brilliant says the root of the problem is really in communities across our state.
Larry Henry works with recovering addicts at the Salvation Army's Harbor Light Center.
What?
You're just smiling.
Emma, I'm happy to see you here.
He's trying to convey lessons from his own personal experience.
I probably had a 9-year span where I used heroin every day.
He says many of today's heroin and other opiate users aren't stereotypical junkies.
They're from good families. They're from pretty wealthy families that get hooked on heroin and they share needles. And it's really it's an epidemic.
The recent outbreak of HIV cases in southern Indiana stemmed mostly from the use of Opana, a painkiller whose users crush pills, mix the powder into a liquid, and inject it. State health officials say they haven't seen this many cases of HIV from this part of the state at one time in at least 15 years.
We want to minimize risky behaviors as much as possible, but even folks that don't feel like they're engaging themselves in risky behaviors need to be aware of those loved ones around them that are and help protect them and provide them the resources that they need.
Chief among those resources, testing.
All right, so this is just an oral swab test.
The Damien Center on the near east side of Indianapolis provides free HIV testing, no questions asked.
So I follow it across on one side, turn it over, do all across the bottom.
A simple saliva swab is all that is necessary, and results are available in just 20 minutes.
We encourage people to come down, find out your status, and that is the key to stemming the tide of HIV infection in Indiana and in America.
Another key is discouraging users from sharing needles, which Larry Henry will tell you is nearly impossible.
The power of the disease of addiction. That's what it is, and that's how powerful it is.
So the solution to the HIV problem revolves in part around solving the rampant use of injectable drugs like heroin and other opiates, which of course is a very, very tall order.
So, Jeremy, what can be done in the short term to prevent the spread of HIV?
Well, there's something right now that the health department is doing in southern Indiana. And it is tricky because in Indiana it's illegal to hand out syringes and needles. So what they're doing is they're handing out these harm reduction kits. It's a mixture of bleach and water so that at least these users can clean the needles and then they won't cause really a health epidemic to increase around the state.
It's definitely a start.
Yes.
Jeremy, thank you.